Okay. So our final speaker today is Meghan McCann, who's a senior policy specialist in the Children and Families Program at the National Conference of State Legislatures, which is also known as NCSL. And if you aren't familiar with NCSL, they are a bipartisan organization based in Denver that provides legislators and staff of all 50 states with research, technical assistance, and opportunities to exchange ideas on pressing state issues. Ms. McCann conducts research and provides technical assistance on child support and family law, poverty reduction strategies, opioids and child welfare, and other human services topics. She is the author or the co-author of numerous publications and NCSL web pages on topics including incarceration and child support and pass-through and disregard of child support. One of her recent publications is a 2-generation strategies toolkit for state legislators. She earned her law degree from the University of Wyoming. And so when I asked how she became interested in this work, she said that she was always interested in helping children and families, which is actually what led her to law school. Since joining NCSL 6 years ago, she has had the opportunity to work on a variety of issues that are important to her, including family law, child welfare, poverty, and childhood trauma. She said these experiences have only solidified her commitment to these issues, and in particular, how they are addressed in state legislatures. Her presentation is titled State Strategies to Prevent and Mitigate the Consequences of Toxic Stress in Childhood. So welcome, Ms. McCann.
Hello. Thank you, Heidi, and thank you for letting me be here today and for the excuse to say that I survived the polar vortex. I was here in January and was glad to leave saying that. I'll add to the why I'm interested in this topic in particular in the early brain science as an excuse to mention my 1-year-old niece and my 4-year-old nephew. So when I hear these presentations and I see the curves of brain development, I always get to think of them, and they're my favorite humans, and so it's always nice to do that. But I could talk about them for days, and I won't do that. But what I will talk about today, I'll provide a little bit about NCSL and our work around adverse childhood experiences and childhood trauma, discuss the prevention of child abuse and neglect, get into some home visiting and how it's been addressed in state legislatures, and then run through some other policy strategies that states have been looking at to address trauma and toxic stress. As Heidi mentioned, NCSL is the nation's bipartisan membership legislative research organization. We serve legislators and legislative staff in all 50 states and territories who are all members of our organization by virtue of being part of the legislature. And our mission is threefold. Our DC office ensures a strong, cohesive voice at the federal level by lobbying Congress on behalf of states and the priorities set by our standing committees and standing and executive committees made up of legislators and staff. Our legislative strengthening program in Denver provides professional development and technical assistance to legislators and staff. And then our research and policy division provides research and technical assistance on a variety of policy issues, including health, criminal justice, education, and human services. I am housed in the Children and Families Program, which covers everything that typically falls under the human services umbrella. And I work very closely with our health and our education staff on this issue, ACEs and childhood trauma. And in our health program, with collaboration from the Centers for Disease Control and Prevention, they track 50 state legislation on ACEs and childhood trauma and their injury prevention database. And they connect legislators with national experts and highlight state innovations. And a recent publication that came out last year is the brief Preventing and Mitigating the Effects of Adverse Childhood Experiences. I'll admit that I poached much of those strategies for this presentation, but it is a great publication and is available on our website. So my colleagues this morning have already addressed the Adverse Childhood Experiences study and the 10 of the adverse experiences that may impact a child and the health and well-being over the life course, but here's sort of another look at it. In looking at these two and thinking about the policy strategies that go into them, I tend to split it into two categories. The first is child abuse and neglect, half of them, and the other is the household dysfunction or challenges, and each come with their own unique set of prevention and intervention strategies. So first I'm going to look at child abuse and neglect prevention. And I'll look at it kind of in two ways. First, looking at the scope and the broad reach of child abuse and neglect among the whole population and its impact on state budgets. Then I will look at prevention strategies for child abuse and neglect, including home visiting. In fiscal year 2017, there were 440,000 children in foster care in the United States, and this is the highest number since 2008. In the same year, more than 270,000 children entered foster care, which is a slight decrease, actually just under 270,000 children entered foster care, which is a slight decrease from 2016. But in this chart, you can see that from 2011 to 2017, we've seen a slow uptick in the number of children in foster care and entering foster care each year. And what we're seeing, we've talked a lot about infants and toddlers and the 0 to 3, and I think the prenatal period as well. But the number of children under the age of 1 entering foster care represents the highest percentage by age group of children experiencing abuse and neglect and entering foster care. So as you can see, that number goes up. And in 2017, this group represented 19% of the 270,000 children entering foster care, so almost 20%. And this makes some sense when you consider the overall vulnerability of this population and the impact that any of those experiences might have on them. In addition to the widespread impact of abuse and neglect on children and families, the Centers for Disease Control and Prevention estimate the lifetime costs associated with child abuse and neglect at $124 billion. And when you look at all of the systems that are impacted by child abuse and neglect over the lifespan. This number only represents the financial impact of half of the adverse childhood experiences from the original study. As you can imagine, combined, the financial impact of all adverse childhood experiences could be significantly higher when factoring in mental health and substance use treatment costs and the huge impact of divorce and incarceration rates. So moving on to child abuse and neglect prevention. We've talked home visiting, and I'm so grateful for the overview that Josh provided us of home visiting. But I'll talk about it a little bit within the context of child abuse and neglect prevention. So it is proved, it is shown that child abuse and neglect may be prevented through home visiting. And home visiting is a two-generation whole family approach, intergenerational approach, multi-generational approach, however you want to phrase it, to preventing child abuse and neglect and strengthening families. And in fact, the Commission to Eliminate Child Abuse and Neglect Fatalities, which was convened in 2016, I believe, or released their report in 2016, cited Nurse Family Partnership, a home visiting model, as the only evidence-based program they looked at known to reduce the likelihood of child fatality. In addition to preventing children from experiencing abuse and neglect, home visiting is also considered a program designed to strengthen parents, their relationships with each other, and with their children. One example of this sort of extended services is in Connecticut, where they received a state innovation grant to use leftover McV dollars to provide workforce services to parents participating in their home visiting program. So really designed to help them work with their children, but also work in our communities. As of September 2017, there were 18 home visiting programs that met the federal evidence-based criteria. And this becomes increasingly important when you look at the enactment of the Federal Family First Prevention Services Act that will allow states to use federal foster care or 4E dollars to be used for prevention services if they meet the definition of evidence-based. So this is a really big expansion of the use of those dollars. And states are really working on what it's going to take to get those dollars and be able to use those dollars for prevention services. And I'd be happy to connect you with my colleagues in the child welfare to learn a little bit more about how states are doing that. It's the 4E, so the title 4E of the, so federal foster care dollars, essentially. Yeah, no, it's okay. And state legislatures have been very active in home visiting as well. So in 2008, at least 22 states enacted a variety of legislation related to home visiting. This included the establishment and implementation of home visiting programs, choosing the model and implementing it, funding and supporting existing models, establishing performance outcomes and measures or requiring the reporting of outcomes and measures, and state agency coordination. Some recent conversations, and I think Josh sort of addressed this or touched on it, has been about universal home visiting versus the targeted approach that many states are doing now. So now I'll move on to a discussion of other state strategies states have considered to prevent and mitigate the impact of ACEs in childhood trauma. We've looked a lot of studies look at the behavioral and the physical and mental health impacts of adverse childhood experiences, and that's critical. The rest of my presentation will somewhat focus on the far right column, the other outcomes, such as school readiness, academic achievement, work preparation and performance, financial stress, and the intergenerational nature of ACEs. So states have taken many different approaches that might address ACEs and childhood trauma, and they kind of fall into 4 general buckets. Knowing the data and understanding the issue, building resiliency to help children and parents cope with adversity when, not if it happens, and reducing parental stress and improving family economic stability. I include increasing screening and treatment here, and I know that question came up about screening, and so there have been a lot of questions from state legislators around where screening happens best from an educational setting or well-child visits or in a pediatrician's office where those sensitive conversations happen more often. And I include mental health and substance use treatment because I would be remiss not to in the middle of an opioid epidemic across the country. I won't address some of those strategies directly, but we have a team of folks at NCSL working on that issue that I'm a part of, and I'd be happy to have a discussion with you offline. First is knowing the data. The Behavioral Risk Factor Surveillance System, or BRFSS, it's a terrible acronym, is run by the CDC in all 50 states, DC, and several territories, and it collects various measures of health in states. And between 2009 and 2018, 42 states and DC included adverse childhood experience questions in their survey, and Wisconsin is the state that has done it most frequently. So you guys are a little bit ahead of the curve in states in terms of adding an ACEs question to this survey. And I'll add this in here. I won't get into these bullets specifically. I think it's been covered already today. But what we know from the research is that supportive relationships from stable, caring adults is critical to child development and resiliency. And state strategies to build resiliency include high-quality care and education and home visiting, which we've already touched on. So state legislation addressing and understanding the issue of adverse childhood experiences. So in 2015, since 2015, 27 states have considered nearly 118 bills on adverse childhood experiences, and this information is all tracked in the Injury Prevention Database on NCSL's website. And legislation on this topic includes the development of certain programs, awareness days or recognition that adverse childhood experiences is a major issue that needs to be addressed, trauma-informed approaches in various settings, primarily in educational settings, but not exclusively. Funding and support for programs that address adverse childhood experiences or trauma-informed approaches. The creation of task forces and commissions to learn more about the issue in their state and then have recommendations provided on what can be done. And again, the screening and assessment question. High-quality early care and education can build resiliency in children, improve school readiness, and provide a high return on investment. This is what the research is showing. And the research on the return on investment in early care and education is there are a lot of different studies floating around about what that return on investment looks like. One study, I believe it's from Dr. Heckman, shows a 13% return on investment for high-quality birth to 5 early education for each year of a child's life. And then other studies sort of range between $2 to $17 for every dollar spent on the program. I'd be happy to provide the research on those so you can sort of see where that falls. State legislatures look at this issue from several angles, including affordability, access, and quality. And the Child Care Development and Block Grant, or CCDBG, was reauthorized in 2014. And in 2018, additional funds were provided to states to improve affordability, access, and quality. And we're still learning what states are doing about that, but they are really focused on additional provider or increasing provider rates to increase affordability for families, opening up more slots to increase access, and improving quality. So the last bucket that I'll talk about is family economic stability. And states have looked at several strategies around this. First is 2-generation strategies. So I got the perfect tee up from Josh's presentation for this conversation. And as Heidi mentioned, we do have a 2-generation strategies toolkit for state legislators that provides this information and more detail on what states have been doing. But this model is the concept that when parents thrive, so do their children, and when children are set up to succeed, so are their parents. So the idea of moving both generations or multiple generations up at the same time. So some state approaches include expanding existing programs. As I mentioned, in Connecticut, they've expanded their home visiting program to provide workforce services for the parents participating in the program. Coordinating multiple programs together, and this often looks like job training or education for parents and high-quality childcare in the same setting. Those services are paired together, and we see that in Maine's Family Futures Down East, Oklahoma's CAP Tulsa program, their community action program, and in Massachusetts in their UTech Lowell program, which works with formerly incarcerated or men at risk of being incarcerated. And then statewide approaches. So Colorado and Connecticut are examples. Colorado has embedded 2Gen in their Department of Human Services, so each division within the Department of Human Services is required to frame things in a 2-generation way and be thinking about it as they do programming. And Connecticut just introduced legislation this last week to create a 2-generation cabinet within their executive office. So it would work with all agencies across the state to implement 2-generation strategies. Some other ideas, and I'll walk through these the next few pretty quickly so we can move on. The Earned Income Tax Credit. State legislatures have done a great deal and introduced a lot of legislation to implement and increase the EITC for families. One option that I know has been considered here in Wisconsin, I believe, is the staggered approach to the payment of Earned Income Tax Credit. So it's not a once-a-year windfall, but more of a monthly income supplement over the year. I think a couple of states have been looking at that. I think Hawaii was the other state that was considering that approach. But we have a lot more resources on that if you're interested. And I'll breeze through this, but these are often cited as ways of reducing parental stress and increasing family economic stability, paid family leave and minimum wage. We have a lot of resources on that, but I'll just leave the most recent state legislation or state status that we have there. And lastly is child support policy. So on average, in 2008, child support lifted 1 million people out of poverty, and on average, it can represent 40% of income for low-income families. One policy designed to improve family economic stability is child support pass-through and disregard policies. So the idea that when someone receives temporary assistance for needy families or public assistance, they assign their right to child support over to the state. So when child support is collected, it goes to the state to reimburse for those benefits. This policy is about passing through some or all of those funds directly to the family so that it benefits the family. Wisconsin does pass through about 75% of child support collections. And in 2017, overall across the country, 96% of overall collections, $32 billion, was passed directly to families. So about 25 states have implemented some sort of pass-through of child support. And I'm happy to get into it. It's a pretty technical and complicated policy, so I'm happy to discuss that further. Another approach states have been looking at is incorporating employment services into child support. So partnerships between child support programs and temporary assistance for needy families to provide employment services to non-custodial parents who owe child support to ensure that they have the income necessary to either withhold or to pay their child support. And there is a federal child support parent employment demonstration grantees. I believe Wisconsin is one of them and is being evaluated by the Institute for Research on Poverty here at UW. So that's a quick, I'm happy to discuss all of these further, but that's a quick rundown of some policies that can improve family economic stability and reduce parental stress, and which can ultimately prevent and mitigate the impact of adverse childhood experiences and childhood trauma. And I'll briefly mention, because we have a video at the end, so I want time for that, is Tennessee and a couple states that have done statewide ACEs initiatives. So Tennessee has their Building Strong Brains Tennessee, and this came out of their 3-branch institute, and Wisconsin actually was part of our 3-branch institute the same year that Tennessee was. And so what came out of that was this Building Strong Brains. It's a collaborative of many state agencies coming together to talk about adverse childhood experiences and how they can collaborate and work to prevent and address the impacts. And I'll mention Wisconsin's Fostering Futures. I mentioned this, you're probably familiar with it, but I'll mention it here as an example. We use Wisconsin a lot when we talk about this across the country. When we are asked questions about what states are doing a lot around adverse childhood experiences, you are one of the case studies and the examples that we use. And so I just wanted to highlight that for you. And so we'll move on to the video. So you probably, you may have heard of Dr. Nadine Burke-Harris. You may have seen her TED Talk or attended the session we had at our legislative summit in Boston. She's also just been appointed the first Attorney General for the state of California. And so she was at our legislative summit, and this is a brief video.
I would say the three things that I believe are critically important is for legislators to understand, number one, that this is all of us. There is no state in the country, there is no district, there is no county in the United States of America that is not being significantly impacted by adverse childhood experiences and toxic stress. That's number one. Number two would be an understanding that we are all part of the solution and that we really need to come together to think about what strategies set the strongest foundation for our children for the remainder of their lives. And number three is really an understanding that although adverse childhood experiences increase our risk for health and behavioral and all kinds of adverse outcomes later on in life, that this is not written in stone. The science shows us that early detection and early intervention improves outcomes, not only in brain development and the development of other systems, the immune system, hormonal systems, but also that the earlier we detect, the better folks do. And I think that is critically important. So yes, it's a big problem, but it's something that we have the science to do something about it.
Okay. So not that I want to follow Dr. Burke-Harris in any way, so I'm going to stop there and take any questions. And so here are my top takeaways. What ACEs are, we kind of know that. The impact of ACEs and toxic stress are not predetermined, as Dr. Burke-Harris just mentioned. It's not set in stone, and there are strategies that can intervene. And states have been exploring various policy options, including high-quality early care and education and improving family economic stability. So happy to take questions.